Hi, good afternoon. I'm Jenny Sasser from the University of Mississippi Medical Center, and I'm here today with Dr. Katie Meyer from the University of North Carolina. Katie gave an absolutely fabulous presentation this morning in the recent advances part of the meeting on the role of the microbiome, and her focus was on nutrition and microbiome. So Katie, can you tell us a little bit about what you presented this morning?
Yes, thank you. It's great to be here. This morning I presented results from a population-based cohort study that I work with. It's called CARDIA, Coronary Artery Risk Development in Young Adults. I've been working with the CARDIA study for a few years. CARDIA started in 1985 and recruited Black and white Americans from 4 urban centers in the U.S. And we had an opportunity just a few years ago to collect stool samples from CARDIA participants so that we could study the microbiome. And today I presented some of the results showing an association between the microbiome and hypertension. This is the first large population-based study showing this association.
So what are the things that we could do to keep our microbiome healthy to try to reduce the risk of hypertension?
Well, that's a really good question. It's we still don't know the extent to which our microbiome can be changed deliberately through things like diet and physical activity, though we do see that, and some of the data I presented today, people with higher diet quality have greater microbial diversity, and that's considered a good thing. Results that I didn't present today, but what we have show that physical activity also increases microbial diversity.
Okay, so sticking with the AHA theme
Exactly.
of healthy diet and lots of activity, great. So what do you think the big advances will be in the next few years for the field?
Well, what I'm really excited about, and spent a fair amount of time in the talk showing some of the results around nutrition and how the gut, and really is how I got into this field. I'm a nutritional epidemiologist by training, and my interest in the microbiome is its role as a potential mediator for dietary effects, because a lot of what we eat is metabolized by the microbiome, and compounds are produced that we know are related to health, and people are different in the extent to which they produce these compounds called metabolites from different dietary components. And so really understanding the how variable dietary response is to the same diet, how different people respond to the same diet, identifying some of these metabolites that might be associated with hypertension, either to develop hypertension, or sometimes some of these metabolites and the gut microbiome itself interferes with drug effectiveness. And so identifying the metabolites as well as the microbial features allows 2 potential pathways for targeted intervention.
Okay. So, and we hear a lot about taking your probiotics or ingesting prebiotics. So is it really as simple as just taking a pill, or do we not know enough about that yet?
We really don't know very much about probiotics, but certainly prebiotics in the form of fiber, that would be a component of a healthy diet, such as the DASH diet, or the AHA's recommended diet. And so but again, there's so much that we don't know. It's a very exciting field, but we're still really in the early stages.
Well, yes, I think you're right. I think it is very exciting, and we have a lot of work left to do. So we appreciate all the contributions that you're making, and thank you for your wonderful presentation today. We appreciate all your work that you're doing to support the American Heart Association mission of building healthier lives free of cardiovascular disease and stroke.